All right, y'all. So this week's research spotlight is unilateral spatial neglect. It's from Swan in 2001. So a little bit of an older article, but I thought it would be good because I had to read this after working with a patient with left inattention and global aphasia as kind of a reflection activity after a mentor session. And I think it does a good job of kind of bringing more information and kind of more of a neuroanatomical basis and understanding of neglect rather than, oh, they just have neglect, they just don't pay attention to that side. So in the article, it kind of describes three types of neglect. So we have memory perceptual neglect. So patients that have pure perceptual neglect will not have any visual field issues, but they can have no representation of what they're seeing on the left side within their brain. So their perception of what they're seeing in that visual field is totally impaired, and they can't really make out that image or remember what it is, even though they can actually physically see it. The second type of neglect is an action intentional or motor neglect, or action inattentional. Motor neglect is a better way to put it. And basically that means that they have no damage to the motor cortex or motor output neuroanatomical structures or the motor tracts, but they do not activate muscles on that side of their body unless it's brought to their attention. So like you could say, move your left arm, and they would have no clue, like they would not be able to do it. But then if you like provided some input, they might be able to do it. And when they were describing this, they talked about a study that looked at monkeys, where they were able to imply a lesion that brought on this motor neglect. And following the man-made lesion in these monkeys, they had full force output, but they were not able to use that side unless a sensory stimulation was provided onto it, which is just fascinating. And that's how my patient on Thursday actually kind of presented. They had really good strength in that side, but unless you provided tactile input or proprioceptive input or tons of verbal input, they had no real functional use of that side. Then there's a sensory input. So there's no damage to the sensory processing or sensory tracts, but they have no conscious understanding or perception of sensation on that side. And it's fascinating to me that our brain, this perception and the need for our brains to perceive that is so strong when even the tracts themselves and the areas of the brain that understand that and receive those tracts or output those tracts aren't damaged, that they can still have this neglect. So those are the three different types of neglect: memory perceptual, and then motor and sensory neglect. And then the article kind of goes on to talk a little bit about the neuroanatomy of it, and I'll put one of the charts from the article up on the screen here. And basically there are so many neuroanatomical structures that go into our ability to have full conscious perception of our reality and what's going on. And I'm not going to get into, whether or not our brains build and predict our reality or not. It's a different conversation, and it's not really touched on in this article. But we have our reticular activating system, which is kind of responsible for our arousal levels and keeping us awake. And then we have our locus coeruleus that's responsible for increasing and decreasing levels of attention, at least as I understand it. And then we have our visual perceptual system, our sensory perceptual system, and then our internal feedback systems. And all of those play into our ability to perceive the world and basically not have neglect. And they're one of the things the article touches on, and one of my favorite pieces of the article, and I'll put this quote on the screen here, is that basically there's not any specific area of the brain that you can lesion and say is going to present with one type of neglect or another. And I think that's really, really important, and it kind of fits with a new idea that I've been kind of floating around in my head about just like how the brain works and how I understand how the brain works, because the connections and the tracks and the systems that are so involved with our ability of perception and in preventing us from having a neglect towards one side or the other, whether it be motor, sensory, or memory perceptual, are so complicated and interconnected that you can't specifically point to one area and say that oh, if they have a lesion there, they're going to have sensory neglect, or if they have a lesion there, they're going to have motor neglect. And I just find that so fascinating that our brains are built and so fluid in the way that they function that we still, I mean, this article was written in 2001, but still in 2020, I think we have a really poor understanding of exactly how the brain works, like just as a species, how our own brain works. Getting a little off track here, but they talk about that in the article, and the chart that I put up earlier also kind of describes that. And then towards the end of the article, it talks about treatment options. So some of the treatment options looked at using prism glasses to kind of shift their visual field towards that side. Looked at increasing inner body sensation onto that side by providing a stretch to the cervical musculature to provide further input onto that side. It talked about using reading and scanning attentional tasks, with most of the tasks towards that neglected side. That's more for that memory perceptual. Talked about just kind of drawing attention to that side, using imagery to have patients describe objects and try and describe entire portions of objects. Again, that's kind of more towards that memory perceptual type of neglect. And I'm not going to go into the rest of the treatment details on there because it kind of gets into using, I guess I will move a little bit. It gets into using eye patches because based on the different portions of the eye, whether it's the neglected or non-neglected side of each eye, or the neglected eye, the side, hemi-body side that has the eye on the same side that they're hemi-neglecting. And it talks about how the different activation patterns within the brainstem kind of bias different visual fields and different visual attentional fields. I can't remember exactly what the results for that section were, but if I remember correctly, it improved some of the outcomes, but not all of the outcomes in the study that they were referencing. But I don't think it's super effective in terms of the eye patch, just because from what I remember, I don't think it was. But I would encourage you to go back into the article and look at that if it's something that you're interested in. But a great article if you're working with anybody who has brain lesions, whether it's traumatic brain injury or patients post-stroke. If they have any possible neglect or appear to be having any possible neglect, I highly would recommend reading this article. It's super fascinating to me, just the concept of neglect and the idea of all of these brain systems working together and interacting, and how they all come into play for our ability to perceive our environment fully. So that's this week's research article of the week. I'll put the link to the article and stuff like that down below. I highly encourage you to read it, and hopefully it can help you in your clinical practice. Thanks for watching.